Thank you for listening to Depictions Media Radio.
Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for September 3rd, 2020. Today we'll be providing our 8th modelling briefing. You'll remember that BC did the first one in Canada on March the 27th, and we've used, and Dr. Henry has used these modelling briefings to let all of you see what she sees and what we see when we're developing our response to COVID-19. This is also our 110th in-person briefing so far in response to the COVID-19 pandemic in British Columbia, when we're honored to be doing it here on the territories of the Squamish, of the Musqueam, of the Tsleil-Waututh people. Tomorrow, Friday, at 3 o'clock, we'll be providing written briefing with detailed information and case counts and other relevant information for the COVID-19 pandemic in British Columbia. And with that, it's my honor, as always, to introduce Dr. Bonnie Henry.
Thank you very much, and good afternoon. We'll start by reviewing the update of our cases here today in British Columbia. We have 89 new cases who have been diagnosed with COVID-19, including one epidemiologically linked cases, bringing our total number of cases in British Columbia to 6,041 people. That includes 2,012 people in the Vancouver Coastal Health region, 3,155 in the Fraser Health region, 178 people on Vancouver Island Health region, 450 people in the Interior Health region, 167 in the Northern Health region, and 79 people who reside outside of Canada. We now have 1,175 active cases in British Columbia, of whom 34 are in hospital, 11 of whom are in critical care or ICU. We sadly have had one additional death in long-term care, bringing the total number of people who've died from COVID-19 in BC to 210. And as always, our condolences and our thoughts go to the families, the communities, and the care providers of this person. We have 2,801 people now currently under active public health follow-up and 4,644 people who have fully recovered. We have 2 new healthcare outbreaks, both of which have a single person identified, and investigations and an outbreak response is ongoing. Those are at the Charrington Place Long-Term Care Home in Fraser Health and the Point Grey Private Hospital in Vancouver Coastal Health. The Maple Ridge Seniors Village outbreak that is now declared over. So that leaves us with 11 active outbreaks in our healthcare system and 730 people who have been identified, 443 residents and 287 staff. We have no new community outbreaks, but as we know, there are a number ongoing exposure events where there has been transmission to people in communities across BC. And please continue to check our health authority websites and the BC CDC websites regularly for guidance on what you need to do if you've been involved in one of these exposure events. I'm now going to put my glasses on. I'm now going to walk us through some of the update on the numbers and some more information and the modelling that we've been using, as Minister Dix mentioned, to guide our response here in British Columbia. So our last week, this is a profile of what we've been seeing. As we know, we've had an increased number of cases per day, again, in the past week, with 547 new cases. The one thing that you will note is that the median age has gone down. Where previously the age of our cases was in the 50s, we've now gone down to a median age of 41. And what that reflects is the fact that many of our new cases are in younger people. Though our hospitalizations have gone up slightly, again, the hospitalization rate remains very low. And it has actually come down from when we were in the midst of our first wave of this pandemic, where about 20% of our cases ended up in hospital. And that again reflects the fact that many of our new cases are younger people. As of last week, we had 4 new people who had died from COVID-19. Again, the median age remains very high, reflecting that this virus is most lethal to our elders and seniors. In addition, we've had a number over 4,200 removed from isolation. About 80% of our cases now have recovered, and that should not say the median age was 906. That is a reflection of the actual active cases we had last week. This is an update of the geographic distribution by HSDA, Health Service Delivery Area. And again, this week we have seen active cases in areas that had not had previous cases, or at least hadn't for some time. And this, of course, reflects the fact that this virus is still circulating. And when it is circulating anywhere, it means that all of our communities can be at risk, and how important it is for us to continue to take the measures to protect particularly those people who have vulnerabilities that make them susceptible to more severe illness. Again, though, the focus really of the outbreak now has returned to the Lower Mainland, where the majority of cases are. This is our epidemic curve by reported date, so that's the date the lab test was reported. And as you can see, we have had a substantial increase in numbers of cases reported over the last few weeks. And we have also had a substantial increase in the number of tests that we're doing every day, with an average being between 4,000 and 5,000 compared to when we were in March. And so what this does tell us is that even though we have a higher numbers of cases, we are finding and testing more people than we were in March who have this illness. So we don't believe that the number of people who are out there with COVID-19 that aren't detected is as high as it was when our testing was limited. This is a reflection, again, of an update on our likely source of infection. And as we can tell by the shades of pink that we have here, the vast majority of our cases are linked to known exposure events in our local area. And we have we have some more information that I'll be presenting about what types of settings those are where people are being exposed. We do still have some people who are coming into BC and Canada from international travel who continue to test positive, including some temporary foreign workers and other Canadians who have returned home from countries like India, from the United States, and other countries around the world. This is a good representation of what is happening in the phase of the pandemic that we're in right now, and it shows us that in the last few weeks the virus is really spreading amongst younger people. So the top green line is people 20 to 29, and the line just below it is 30 to 39 year olds, and that's where we've seen the dramatic increase in growth in the last few weeks. Having said that, in the last week, we've also seen increases in slightly older populations, including 40 to 49, and an increase in younger children as well, reflecting transmission that's happening in communities and homes. And this is a similar depiction of the proportions that we're seeing in different age groups as we've progressed in our pandemic here in British Columbia. And right now, the proportion of cases are in the largest proportion of cases in the dark purple are in young people between the ages of 20 to 29. And that's reflecting what we've been seeing over the past few weeks this summer that we've reported on. Many of these interactions are social interactions where it has been spread amongst social networks. And to help us understand a little better about those environments where exposure events are happening, in the settings where people are being exposed and becoming infected with COVID-19, we've created this lovely series of figures that help us look at this by age group. So what we have is the percent along the y-axis, and along the bottom we have the age groups. So the x-axis tells us by different age groups. And what the different colors reflect is the proportion of those cases in that age group that are infected in different settings. And this is taking that big group of people that we know were infected locally, either through clusters or exposures. And it starts off with the dark red being household contact. So that's when it's transmitted between people in a family or a household setting. The lighter red-orange is community settings, and those would be things like some of the parties outside in the beaches or exposure events in the community. Then we have the orange being private parties or events, the yellow being restaurants, bars, lounges, the lighter green being workplaces, and there are a whole variety of workplaces over the past few months that we have had exposure events, including healthcare workplaces. We know there's been food processing plants. We've had some industrial camp outbreaks, mostly smaller ones, and we've had a whole series of outbreaks in other small workplaces that I'll talk about in a minute. And then, so those are, if we look at the top of this, there's 3 different time periods that we have depicted here. From January 1st to May 18th, that is the first part of our pandemic when we put in place those, when we were detecting cases and then put in place measures to reduce transmissions in our community, people staying home, not traveling, etc. And what we can see from that is there are very few settings where people are being exposed. It's mostly for the younger people, exposures at home, and for older people, exposures in the healthcare setting. And of course, that reflects the fact that we had a lot of exposures in our long-term care homes early on. The second middle figure is May 19th to June 23rd. So that's as we started our restart here in British Columbia. And again, we can still see that there's a few more increased settings that are reflected here. But again, most exposures, particularly in young people, were at home, and in older people in long-term care and other settings. And finally, the bottom one is the one I want to focus on, because that's where we are right now. And this is where we can see what is happening right now, where we are seeing people being exposed. And these are the things that we've been looking at in terms of understanding what measures we can take to try and control the pandemic that we are in now. So this is just the bottom phase. This is where we have seen cases by exposure during phase 3. And really what stands out to me is that for young children and for older people, it is still the same. The most exposures events are in households. So it's being transmitted from an adult who brings it into the household to children, for the most part. And in older adults, it really reflects, again, the transmission that we continue to have in long-term care homes. In the middle, though, what we're seeing is the differing settings that people can be exposed in now that we have started to open up different parts of our economy and of our society. So we see in the working age adults that there are exposure events that are happening in workplaces. And as I mentioned, these are a variety of workplaces. We've had large clusters in some workplaces like the poultry processing plants. We had other agricultural plants. We've also seen transmission between workers in settings from restaurants to fast food restaurants, warehouses, office settings. And in those places, the transmission has generally been between workers who either congregate together in their workplace without taking the precautions that they normally would take, or sometimes it is because they have the same social connections outside of the workplace, and that can bring it into the workplace, and there'd be 1 or 2 transmission events there. For the most part, what we have not seen is a lot of transmission in workplaces from workers to the public in many settings. The blue here, where we call other settings, it reflects things like gyms, other facilities that are open where there is contact with people that have led to transmission events. And in yellow, what we can see for particularly the younger adult ages, 20 to 49 in particular, we see clusters of cases that are related to restaurants, bars, and lounges, some of those being very high-profile ones that we've heard about in the last few weeks, as well as private parties and events. And this should be no surprise, as we know we've been reporting on the Kelowna cluster, for example, which was associated with a variety of these settings. So these are not exact, but what they do tell us is that there's no one single measure that can make a difference in all of these settings. And the measures that we've been taking around increasing restrictions on what we need to do in restaurants, in bars, in nightclubs, the restrictions on people having larger parties for private parties and events, the restrictions on numbers in events, including the need for social distancing, for physical distancing, for having those other measures in place, are all continue to be important in terms of us stopping the transmission of this virus in our communities across BC. The other thing I wanted to focus on is a little bit about what we're talking about when we say we have community transmission. And so these are rates, the incident rates, so the number of new cases in the last week by health authority per population. And it's a measure that allows us to compare to, for example, other jurisdictions in Canada or the United States or around the world. So we've broken it down by health authority, and as you can see, in most of BC, our community transmission rates are very low. So if we look at the interior, Vancouver Island, less than 2 per 100,000 per population in those areas. It's a little bit higher in the north right now because we have a cluster of cases that was related to people coming back from a large religious event in Alberta. We have a focus, as we've been talking about, in the Lower Mainland, and rates in Vancouver Coastal and Fraser are in the vicinity of 15, 16 per 100,000. And if we put that into the context of some of the guidance that we've seen come out of Europe and the US, where the cutoff for being safe for things like full opening of schools and businesses, they use a measure of 25 per 100,000. And then we can see across BC, we are well below that. So when I talk about our community transmission rates being low, this is what we're talking about. And this is a very crude measure. It takes everybody and lumps them all in together. But what we can see is that it's even lower in school-age children, for example, and we can segment it out that way as well. But really this is to tell us that we still are seeing this virus circulating in our community, but we are finding that balance of keeping that circulation as low as we can, and we need to continue to take measures to keep it that way as we move into the fall. I also wanted to, we've had an uptick in people in hospital, but as we've seen, it's mostly younger people right now who are being infected with this virus and passing it on amongst each other and amongst their social connections. And that is reflected in the fact that our hospitalizations still remain very low. And we know from the very beginning, one of the important considerations with this pandemic is making sure that we protect our healthcare system so it is there to provide needed health services to everybody, whether that's surgeries, whether that's people having motor vehicle crashes or breaking bones or having heart attacks. And we are monitoring that very carefully. We are also monitoring how many people are in our ICUs around the province. And again, that remains very low. And that remains at a manageable level. Having said that, we don't want these numbers to increase any further. These are comparisons that we've just updated from ones that we've shown before. So this is our cases per million here compared to a number of other jurisdictions and the rest of Canada. And as we can see, BC remains low. Same as we compare ourselves to other provinces, we have a slight uptick, but we are still very low. And this is also reflected in the numbers of deaths that we've seen in British Columbia. And really this is a testament to the work that we have all done together to protect the most vulnerable in our communities, particularly our seniors and elders. And this is the comparison of what we have seen in BC compared to other provinces here in Canada. Finally, I do want to also talk about our lab testing. I mentioned that we've been doing the highest number of tests per day that we've done across this pandemic. And as you know, we are testing anybody with any symptoms right now in BC. So that's what we call high-risk testing. The pre-test probability right now, if you have any symptoms, that it will be COVID is higher than it was previously. And we're now doing about 4,000 to 5,000 tests a day, which is up about 10% from last week, and that's reflecting in the numbers that we're seeing this week. Our percent positivity, so for every 100 tests that's done, 2 of them are positive approximately. So that is also reassuring. It means that we are picking up people in our community who are positive, and that most of the people with symptoms don't have COVID. Our mean turnaround time for the test has gone up a little bit, and that reflects the fact that we're having more people going in per day for tests, and we've had some challenges in some parts of the province in terms of access to testing as well. But the lab capacity remains good, and we remain focused on increasing our potential, our capacity to test to a level that's much higher than this as we move into the fall. And we also want to talk a little bit about updating on the models that we've been using that helps us understand how the dynamics have been going here in British Columbia. And this is our mobility. We've seen this before. What it shows is that we are gradually coming back in the places that we are going, particularly retail, recreation facilities, grocery stores, pharmacies have gone back up to normal. We still remain below previous to the pandemic. Our rates around transit and workplaces, although that is steadily increasing as well. And I think happily we're still making use of the amazing parks and recreational outdoor spaces that we have in British Columbia. So some of that mobility data goes into this dynamic compartmental modeling, and that is our reproductive number. And as we can see, we've been bouncing around. We know we've had exposure events where there has been transmission to larger numbers of people, and that is pushes the R naught up. We've come down again with the measures that we've taken across the province, but this is it's a movable number, and partly that reflects the fact that we still have low numbers overall compared to the population in BC. But this is something that we are watching, because this gives us an idea of how well we're doing at stopping those chains of transmission. So it's the number about how many people I infect if I get sick. And this reflects the work that we're doing in public health to make sure that every single case, we identify all of your contacts, and we make sure that you are no longer able to infect others, that you're aware of your risk, and that you're staying away from others during the incubation period. This is an update as well of the scenarios that we have been updating as we go along over the last 8 presentations of this. So right now, we estimate that we're at that somewhere around 65% of normal, somewhere in between that 60% scenario and the 70% scenario. So we still have it in our hands, in our actions, to bend our curve back down. And that is what we need to focus on now. We're at that limit. We're at that precipice, if you will, where we need to take the actions to ensure that we can move forward into the fall and keep our curve low. Just a summary of this. Our model does show that there's a lot of variation. Part of that instability that we call it is because our rates are low. But it also illustrates the importance of reducing transmission from every single case. And that is the things that we all do together. So with COVID-19 in our province, we have continued to adapt our approach as we learn more about the virus and what we need to do to protect ourselves and those around us. But it also is important that we understand the impacts that the measures we've put in place have had as well. So what does this data tell us? It tells us that for the most part, in recent weeks, we've been able to find that balance, keeping essential services businesses going, protecting our most vulnerable. It also tells us that as we prepare for the respiratory season ahead, we need to continue to work to break those chains of transmission as efficiently and as effectively as possible. And we all play a role in that. Our focus needs to be on keeping the balance, maintaining our vibrant, healthy communities, and keeping new cases low. Our well-being as a community, as a province, is about getting back to work, getting back into classrooms, keeping businesses going, and staying healthy. It's not an either-or situation. What we do need to do is pause those activities that we know are a high risk for all of us. And we've seen some of that in the past few weeks, especially spending time with groups of people that we don't know without taking personal precautions to prevent the spread of the virus. We simply have to look at the successes we have seen to show us what we need to do. Thousands of our restaurants have reopened. We know how important things like restaurants and corner stores and small businesses are to our well-being as a community. Millions of trees have been planted in BC this summer due to the effective safety plans that we had in place and people being able to go back to work. And many people have safely restarted recreational sports, community events, once again, just to name a few examples. But one way to think about your activities in the weeks ahead is to think about the numbers of contacts that you have. There's no magic number, but we know the fewer people, the better. And for some people, their own risk will mean that those numbers need to stay very small. So if you know you have more interactions ahead, for example, if you're returning to work, then you need to reduce your contacts in other areas. We need to find that personal balance, and that will mean a sacrifice for some of us in some areas of our life. We also know that different interactions require different precautions based on our risks and our personal circumstances. That's why we have this concept of a COVID-19 safety plan. We need it for every business, every organization in our province. And we should think about our own personal COVID safety plan for our family and how that looks and how that works. So if you're going back to work in an open plan office, for example, you need to stay within your team, that small number of people that you see every day, consistent number of people. The number of people, so you want to limit visitors. Have visits with others virtually. Maintain your distance with those small number of people, but you may not have to always keep that 2-meter distance. 2 meters is better, but with people that you are, the same people that you're with on an ongoing basis, 1 meter is probably fine for most of your interactions. Recognizing the really important piece that we have to protect us all, which is staying home if we're ill ourselves. If your parents are helping to care for your children, then you will have to consider things like spending less time with friends outside of your household or your family. Because grandparents, we know, are more vulnerable to severe illness, and we need to keep those external circles small. If you're starting university this fall, most of your classes will be online for now, but help to keep the university and your community safe by avoiding in-person social events with large groups of people. Keep your close contacts small. And of course, no matter who you are or what you may be doing, staying home when you're feeling even slightly ill is a requirement for all of us. And if you have symptoms of COVID-19, you need to be tested. We know that giving people the space to stay safe is very important for all of us. For the first few months, we spent a lot of time in this pandemic talking about giving 2 meters between people outside our bubbles. And we've talked about the importance of wearing masks when you can't maintain that. 2 meters is the ideal, we know, for uncontrolled environments, particularly with people we don't know. But 1 meter is also good if you're with the same group of people you know and see regularly, such as work colleagues, classmates, for example. The distance can be less because these are controlled situations where we have the same people, where we have a limited number of people that we are actually in that environment with on an ongoing period of time. And we've seen this work in some of the COVID safety plans that we've had, for example, with pods of workers who travel together to a workplace. And this is how we control the spread, but also we keep each other safe by making sure that we're not having contacts that are unsafe with lots of people. Close face-to-face contact for extended periods of time with anyone outside your household bubble should be avoided. So those are the things that we know are riskier when we're having conversations, whether it's inside or outside, inside being riskier, in parties and events where we're singing, when we're hugging, when we're close to people, when we're eating and drinking together. And that can be things like having staff get together in a staff room, for example, or having coffee. We have seen this virus transmit in those ways. So those are the things that are riskier than sitting together in an office environment or even having a meeting when we're at a distance from each other. If close-to-close contact is unavoidable, then wear a mask. I understand this is not straightforward, and it's very challenging for us to think about our own situations. And it's different than it was at the start of the pandemic because we need to continue to for the well-being of our community, to keep things moving. But it is helpful to remember that as we move into different environments, the basics stay the same. I do also want to remind people that being outside is less risky than inside. And if we're just walking by somebody on the street, that is not a risk for transmission of this virus. So we need to make sure that we are okay with that type of outside environment, and that it's fine to go outside. It's okay to avoid physical contact on a playground. We've seen that work very effectively where we don't see transmission between children, and we just remind them and teach them not to touch each other versus staying that 2 meters apart. Those are the types of risk assessments we can do for ourselves on an ongoing basis. So we are keeping a fine balance, but it is at the edge. And it's because most people are taking the precautions that we know work. And because of the work of public health and contact tracing and in finding people who have been exposed so that we can stop those chains of transmission. Now we have the choice. As we are moving into the fall, where we know more people are going back to work, we know children will be going back to schools, we know the respiratory season is coming, we need to all continue to make those choices that keep our communities, our elders, our loved ones, and ourselves safe. And this weekend in particular, choose to go small. Choose to spend time with your household bubble instead of a group of strangers. And choose to use those layers of protection wherever you may go. Let's make sure this Labor Day long weekend we are united in our singular focus to continue to stop those chains of transmission and bring our curve back down. And of course, let's continue to do this by being kind, being calm, and being safe. Thank you.
Thank you very much, Dr. Henry, and I wanted to start by, on behalf of the Premier, on behalf of the government, expressing my condolences to the family and to the friends and the community of caregivers and the community of the person who passed away from COVID-19 in the last 24 hours. Lives in the Fraser Health Authority in long-term care, and as we all know, and as I think virtually everyone in BC has experienced the loss of someone they care for during the time of this pandemic, and it is a very challenging time to express grief, to grieve together because of the limitations imposed on us by the COVID-19 pandemic. So I want to especially express my condolences to this family today, to the other 209 families of people who've passed away in BC from COVID-19, and to those who've lost loved ones to our other public health emergency, the overdose crisis, which continues to beset us here in British Columbia. I wanted to note, and then I'm going to deal with a few slides with respect to our surgical plan, but I wanted to note the work of public health in the last day, and this resulted, as Dr. Henry has said, in the 89 test positives in BC, that 5,735 COVID-19 tests were conducted in BC across health authorities, that 2,801 people are in self-isolation and are effectively public health surveillance, that we have 1,175 active cases in BC, and express my sense of gratitude and support for all those in public health who are doing this extraordinary work at this time. I also wanted to note that we have today 34 people in hospital, and that represents 21 people in Fraser Health, 5 in Northern Health, 7 in the Vancouver Coastal Health Authority who reside in Vancouver Coastal Health, and 1 who's in a Vancouver Coastal Health Authority hospital, but it resides out of Canada. I wanted to update you now on the surgical renewal update, and we'll just, I think, move forward here. As you'll know, that on May the 7th, we released our commitment to surgical renewal to allow us to keep up with new demands for surgeries and complete the surgeries that were delayed and lost due to COVID-19. On Tuesday, we released our second monthly progress report. It covered the period from June the 26th to July the 23rd. Focusing on patients, increasing services, and increasing essential personnel are at the core of this commitment. In our first monthly report, we were meeting our targets in these areas, and this achievement continues. By July 23rd, we delivered surgeries to 11,249 patients, almost 66% of the 17,154 patients whose surgery was postponed. That was as of July 23rd. Obviously, and as you will see in a moment, significant surgeries have been performed since that time. In that period, that same period, we performed in a time of COVID-19 with new techniques and methods to keep people safe. We still performed 904 more surgeries than the same period the previous year. That was in June and July, when we were just launching really our surgical renewal plan. Operating hours increased by 6%, hip surgeries increased by 4%, knee surgeries by 4%, and dental surgeries by 2% over the same period last year in our priority areas. We performed 7,368 urgent surgeries. That's an increase over the same time period last year. In the midst of the COVID-19 pandemic, we doubled the number of non-urgent surgeries completed for patients waiting longer than 2 times their target wait. So all of that is an extraordinary achievement not by me or by the government or by anyone else, but by the people who work in our healthcare system, and I am so grateful. I'm grateful at 7 o'clock, and I'm grateful now for this work. From June 26th to July 23rd also, we recruited 7 additional anesthesiologists and general practitioner anesthesiologists, and hired an additional 49 perioperative registered nurses, 7 perioperative licensed practical nurses, 13 post-anesthetic recovery registered nurses, and 24 medical device reprocessing technicians. There's a full report on that period leading in to July the 23rd, and it can be found at gov.bc.ca/surgical renewal. And with that, I will give you our regular weekly update on the surgical renewal commitment, which brings it up into the present month. The number of patients since May contacted about their surgery has increased to 87,258. Between May 18th and August 23rd, we completed 90,671 surgeries. 69,302 were scheduled surgeries, sometimes called elective surgeries, and 21,369 were unscheduled or emergency surgeries. Of those, 17,095 were in Interior Health, 25,229 in Fraser Health, 20,826 in Vancouver Coastal Health, 18,474 in Vancouver Island Health, 5,266 in Northern Health, and 3,781 in the Provincial Health Services Authority. Last week, we reported 6,062 surgeries completed between August 17th and August 23rd. Health authorities have verified their data, and the total number of surgeries completed was actually higher than that, 6,377, an increase of 249 surgeries over the same period last year. This week we completed a further 6,088 surgeries in August. We expect to see some lower completions over the next weekend because of the Labor Day holiday. However, we continue to exceed last year's effort again in the midst of a pandemic, and I am thankful to everyone for the hard work involved. I wanted to also bring you up to date on the Premier's announcement now 2 or 3 weeks ago to hire more people to engage in contact tracing, which we will, of course, be continuing to do through the fall, while also enabling public health to do all of the other things that we expect them to do on a regular day in a time of pandemic. We are, in fact, adding to the number of contact tracing personnel we'll be hiring. It's increased to 608. And just for everyone's information, we've had 2,657 individuals express interest in these positions, and more than 600 of them have met the qualifications. A significant number have already been hired. Others are at the interview stage. That is proceeding, and we will be meeting those targets in terms of hiring new workers to work, new people to work in contact tracers. We're talking in many cases about retired nurses and even retired physicians who are coming back into the field to assist the public health care system in this time of pandemic. And again, it demonstrates their commitment to our province, and I think the strength of our public health care system that this is happening. It's part of our continuing effort to prepare for what we need to prepare for in the coming few months, and that will involve efforts, of course, to reduce the transmission of influenza in BC, needless to say, of COVID-19, of ensuring that our long-term care homes have the capacity and the staff that they need. This is going to be an important period, and one that we have been actively working on all summer, and the success of our hiring in terms of contact tracing is a demonstration of that. What we've seen here in BC over the last period, over these 110 briefings, over this period since the middle of January when we formed our COVID-19 emergency response in BC, is, I think, a record of extraordinary work and effort by public health. And I want to acknowledge the extraordinary work of Dr. Bonnie Henry, who has been, along with our Deputy Minister, Stephen Brown, an amazing leader of this effort, someone who has shows not just the brilliance that she has as a scientist, the compassion she has as a doctor, but I think every day and every case and every person and every concern gets her full attention, and I am very honored to be standing here with her. The things that we've achieved, the resumption of surgery, the fact that we restored, albeit limited, visits to long-term care without an increase in transmission to long-term care, the methodical way that we have opened the economy to allow many people to get back to work. These are real achievements that aren't, again, our achievements. They're the achievements of a government. They're the achievements of all of British Columbians, of all of you. And we have to, of course, because we know this. We know that the COVID-19 pandemic will be with us not just for months to come, but in the year to come. And indeed, perhaps in the years to come. We have to continue to be all in. We have to transform this new normal into something that we can live with and embrace and do well together in and advance in. And so, with respect to this long weekend, our task surely is, with all the things in front of us in this fall, all of the things involved in front of us, that we need to stop the spread. Physical distancing saves lives. Stop the spread. Hand hygiene, washing our hands, saves lives because it stops the spread. Staying home if you're not feeling well saves lives because it stops the spread. Wearing a mask when you need to do so, and it's the right thing to do, saves lives because it stops the spread. For some, this long weekend marks the end of summer. For others, it marks a welcome change of season. For all of us this year in a pandemic, at this unsettling time in our world, it needs to be the weekend that we recommit ourselves to stopping the spread. We need to use our skills always. We know where we must use our skills. That's everywhere. And we know why we must use our skills. To stop the spread, to save lives for the ones that we love and for the ones that we don't know. It has been a long, long, long time. And there's going to be many, many months and many challenges ahead of us. But I can't tell you today, as we see these numbers, as we see the work being done in healthcare, as we see the commitment that British Columbians have to one another, we have to, as I say, continue to recommit ourselves to this. We have much to be proud of. There's much left to do. I hope everyone has a safe long weekend, and we'll see you, of course, back next week for more briefings, alas. But we hope that throughout this weekend, we can enjoy the weekend, but also be safe and remember our responsibilities and what we all need to do. Aujourd'hui, nous annonçons 80 nouveaux cas qui ont testé positifs pour COVID-19, pour un total de 6041 cas en Colombie-Britannique. Nous sommes attristés d'annoncer un nouveau décès lié au COVID-19 dans la régie de santé de Fraser, pour un total de 210 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches pendant cette pandémie. Chaque régie de santé, bien entendu, compte les patients atteints de COVID-19. 2012 se trouve à Vancouver Coastal, 3155 à Fraser, 178 sur l'île de Vancouver, 450 dans l'intérieur et 167 au nord. Il y a aussi 79 cas de personnes qui vivent en dehors du Canada. Parmi l'ensemble des cas confirmés de COVID-19, 34 personnes sont actuellement hospitalisées, dont 11 en soins intensifs. À ce jour, 4644 personnes dont le test de dépistage de COVID-19 était positif sont maintenant rétablies. Thank you very much. Merci beaucoup. We're happy to take your questions.
Thank you, Minister. And as a reminder to the media, please press *1 to line up for questions if you haven't already done so. We will be taking one question and one follow-up this afternoon. Also, please do not mute your phones. You will not be audible until I call your name. We begin today with Pinder Sajan, CTV. Pinder, go ahead, please.
Thank you. Dr. Henry, you talk about community transmission being low, and it's a good place that we're at right now in terms of going to school, and yet are appealing to people to kind of pull back a bit on their contacts. For those who are maybe not abiding by the rules, who say, well, if I'm doing what I'm doing, meeting different people on different weekends and having parties, and yet we still have low community transmission, maybe things are okay. What do you say to those people who maybe need a little bit more motivation to pull back on their contacts?
We have seen people adjust their behaviors, and for that I'm very grateful. And I think most people are doing the right thing. We've seen transmission in parties and social events, particularly amongst young people, and we recognize that that is an important part of one's life when you're young. That need for social interaction is so much higher. So now we need to change our focus and do it in a safe way. And we've given people the tools to do that now, once we've recognized that this was a challenge. We do have some enforcement pieces, and that has helped a little bit, I think, in getting people the message. But I also want to say, it is important. It's part of us enjoying society and each other and the joy that we have in life to have social connections. But right now, in this pandemic, we have to do it in a different way. And that means we have to keep that group small, the same group of people. It's the mixing with people that we don't know, that we know is risky, because we are then subjected to the people they've been in contact with, and that risk goes up really quickly. So yes, we do need to have that social interaction, but as we're moving into the fall, we need to rethink how we're going to do that. And for a lot of young people, that means they might be going back into work, they might be working already, they might be going back to university or school. And we need to rethink what that means for us in all aspects of our life going forward.
Yeah, thank you. On slide 8, it says there are unnamed places where people contracted COVID-19, and I'm just wondering if you can explain what exactly that means.
Yeah, so sometimes we don't have all the data, so we put that in. So some of that reflects the fact that we can't link everybody. But the people that we can't link, and I've talked about this before, that I watch very carefully, those unlinked cases, and in our communities, and we make sure that we're not seeing the start of new transmission chains, and that number remains very low. So it's under 20%, even in this phase of the pandemic. So that's mostly what's in that group.
Thank you. The next question comes from Camille Baines, Canadian Press. Camille, go ahead, please.
Thank you. Dr. Henry, my understanding is that flu cases have been very low this season in the southern hemisphere. So how does that factor into your messaging for people to get a flu shot this year, particularly with what potentially could happen with COVID and the flu together, as you've been mentioning?
Yeah, so, what happens in the southern hemisphere does not always reflect what happens here, and we've seen that sometimes it goes both ways. It is a slight glimmer of hope, we can say, that it seems that the measures that are taking to prevent COVID-19 and the very high influenza immunization rates that they achieved in much of the southern hemisphere have made a difference. So my message to people in British Columbia is we all need to do our part to stop influenza this year as well, and that means getting a flu shot, even if this is the first time you've ever had it. It's for your own protection, but it's also for our community, because we need to be able to tell the difference between influenza and COVID. And right now it's easy. We don't have a lot of influenza, but going into the fall, that's going to be our challenge. And we know that influenza also affects those who are more vulnerable to COVID. So we know long-term care for people who are elders and seniors, and also for children. So this is a really important year where influenza shots are very important for all of us, but also those other measures that we know prevent respiratory transmission. So keeping our distance from people, wearing masks when we can't do that, and hand hygiene is incredibly important.
Follow-up, Camille?
When will our flu vaccine program start in BC, and how many more vaccinations did we get this year compared to last year?
Yeah, so we knew what was going on in the southern hemisphere, and as you know, our orders for vaccines went in around February, but we did top that up quite a bit. I can get you the exact numbers, but we've increased by about 20% our extra. I think we're close to 2 million doses this year.
We'll be briefing on that next week.
But we will be, and we have been working with our health authority partners to have a good, strong influenza campaign. Our vaccine tends to arrive a little bit later in September into October, that being the optimal times for us to immunize people prior to the season starting in earnest. And we expect vaccine to start arriving in the coming weeks.
Thank you. The next question comes from Richard Zussman, Global News. Richard?
Dr. Henry, I know people hang off your every word, and one of the things you mentioned in your presentation is, am I correct to assert that in workplaces and schools, it's okay now to maintain 1 meter of physical distance and not 2? And how do you think people will react to what will seemingly be a major shift in people's minds, especially with lingering concerns around school?
Yeah, so I'm not saying it's a gradation. We know that 2 meters is better than 1 meter is better than 0. And so our focus, particularly in young children, has been helping young kids to understand that we don't want to be touching each other. So there's no hugging when you go back into class, even if you're really excited to see your friends again. It's got to be air hugs and air fives and other things that we can do to show how happy we are to be in those settings again. But what we're saying is in a controlled environment, so children sitting at a table or desks in a classroom, facing away or having a distance between them, if you're going to be face-to-face, then absolutely we need that 2 meters. But if we're going to be in rows next to each other, then it's somewhere in between there is perfectly safe. So those are the things that we're learning about this virus, but it's also in the context of the other measures that we have in place, which is you don't go in if you're not feeling well. So if there's nobody sick in your environment, there's no risk. So we need to have all of those pieces in place to make sure that we have a safe environment for everybody. And that's why, it doesn't have to be exactly 6 feet or 6.5 feet or 2 meters. We need to be able to fit people in and know that the type of activities that you're doing in those environments may be safe. And we're seeing that in workplaces where you have a small group of people. So a workplace where you're sitting in your desk or pod or your area and you're always next to the same people, that's a small group of people, then you have a type of interaction that is safe with those people. It's a very different scenario than the risk that you have going to a party in somebody's home where you're talking face to face to a number of other people indoors. So it's gradations of risk, and that's what I know that the teachers and schools are out there looking at how they can make that work in classrooms around the province.
Richard?
Is there anything that worries you on the slide when you show the ages going up, that the 10 to 19-year-olds continue to climb? Is that concerning to you? Are we at a point that demographic should be a worry?
Yeah, not really. It reflects the fact that people are bringing it home and transmission is happening mostly in families still, especially for the younger children. If we look at the absolute numbers, it's still very low. And the numbers and the proportion of infections in the under 10 and 10 to 19-year age group is still much less than the proportion of our population that's made up by that age group. So we're still seeing young people underrepresented in the cases that we're seeing, and we want to keep it that way.
The next question comes from Andrea Wu, Globe and Mail.
Hi, Dr. Henry. Thank you for taking my question. So under current guidelines, when schools reopen, masks will be required in high-traffic areas and settings where physical distancing isn't always possible, such as in hallways and on buses. I'm wondering, is an individual school allowed to implement its own policy, for example, requiring students to wear masks at all times while in the building? And what would your response be to a school wishing to do this?
Yeah, so we have guidance that we've put out across the province, and I know schools are working with their local medical health officers. I'm not aware that any schools have the need for that type of a measure. It is what we would be above and beyond what we feel is needed given the evidence. So I think they need to look at where masks are going to be of benefit and where they may be a hindrance, because we know there's challenges, particularly for younger children, in terms of being able to learn, and it can impede for some children. Having said that, we also know that there are other things that we can use, particularly for adults who are concerned, so teachers and others in the settings, making sure that things like face shields are an option as well. But we also want to make sure we have those layers of protection in our school system, which means that we're not going to be having kids sitting together in groups, that we're going to minimize the numbers of people they have in contact with, that they're going to have their learning pods as one part of it, but that it's still really based on the class and making sure that those that physical distancing is part of the measures that are in place as well.
Follow-up, Andrea?
Sure that I understand that answer. It is above and beyond what the guidance is now, but would they be prohibited from setting their own policy?
I think we would have a discussion about the pros and cons of the policy with the individual school and their local school health officer.
Thank you. Thank you. The next question comes from Marcella Bernardo, News 1130.
Hi, Dr. Henry and Minister Dix. I hate to belabor this, but if a school wants to make masks mandatory, are you saying they are not allowed to, or if they choose to, they can?
I am saying that we will have those discussions, that I'm not aware of any schools who want to, and that we've had a lot of discussions in our planning groups across the province, and that's not come up as an issue. If it did come up as an issue from an individual school, then it would be a conversation with the local school health officer and with the school district.
Follow-up, Marcella?
Yes, during the slideshow we saw, and we heard Minister Dix also say that being outdoors is more of an, you're more safe if you're outdoors. So have you given any thought to reconsidering the ability of having more drive-in concerts or drive-in theaters, expanding their ability to let people go to a movie, or expand that 50-person limit if people are outdoors?
Yeah, so, we've been consistent with our mass gathering number, and that is 50. We do have provisions for outdoor movies and drive-ins that is 50 cars, not 50 people. But no, other than that, we're keeping it at that manageable level. We know that even though people have the best of intentions, when you get large groups together, inevitably people are going to be mixing. And we've seen a number of proposals, and I know people are very disappointed when we say during this time we all have to take these measures. These are the measures that we feel best protect our community on an ongoing basis, and we need to be fair with everybody on how we're implementing them. And we have seen in some other jurisdictions, and certainly here, when those measures are being are not in place, that we have had, unfortunately, transmission of this virus to people, and that has led to ongoing transmission in communities. So we are sticking with the measures that we've put in place, and they're all designed to be that allow enough to happen in our communities that we need, whether it's work, whether it's recreation, whether it's access to being able to have these social events, but not put us at increased risk of having rapidly increasing numbers of people infected and chains of transmission that really affect our entire community.
Thank you. The next question comes from Keith Baldry, Global. Keith, go ahead, please.
Hi, Dr. Henry. Thanks for this. On Monday, you talked about you advised British Columbia to slow down. Today, you said we're on a precipice with limiting things as we go into the fall and the respiratory season. There are rumors at both the federal and provincial level that an election campaign could be called, even though neither is required by law. From your perspective, is it advisable to have election campaigns in the middle of a respiratory season, given with the numbers that we're seeing?
I think it's not my job to say whether an election should happen or not. We have been working, as have my colleagues across the country. I know there's an election in New Brunswick. There's an election coming up as well in Saskatchewan. We've been working with the Chief Electoral Officer here in British Columbia, should the need arise, to make sure that all of the things that we need to do are in place. And we've had a conversation actually just this week with my counterparts across the country, with the Chief Electoral Officer for Canada, to be sure that we're ready no matter what happens. So I think we all need to, like any other event or business, we need to have a COVID safety plan, and that's what we're working on with Elections BC and with Elections Canada.
Follow-up, Keith?
Yes, on a slightly different topic, on slide 20 about the compartmental modeling scenarios, if I read that graph correctly on the 60% of normal, the case numbers climbs consistently. Are you concerned we could be at that 25 case per 100,000 that you referenced, that there were at 18 in Vancouver Coastal, 15 in Fraser? Could we get to that 25 level, and what implications would that have for schools?
Yeah, and it's a challenge to depict a sort of three-dimensional model on a graph. But what that's not a prediction. It's a scenario, a potential scenario, and we have it within our ability to bend that curve down. And what it tells us is that, yes, with what we're doing, we're in that fine balance. So you need to take that along with the reproductive number and look at, where we are in terms of growth. So yes, we expect to continue to see transmission in the community, but it still remains low, and that's our work, all of us, both in public health, in stopping and finding people and making sure that if you've been exposed, you stay isolated. If you have any symptoms, you stay away from others and get tested. And all the rest of us have to think about that too. Right now, it's not either or. It's finding that balance and finding the ways that we can keep our community going, make sure that people can get back to work. We know know how important it is to have our economy going, because it's important for our health as well, and important for the health of our children and our future to get schools going again. So what we need to do, and we've always said, we want to be as close to the line as we need to be to open up as much as we can, but keep that balance, and that's where we'll be focusing on.
Thank you. We have time for one more question this afternoon. For everyone tuning in, Dr. Henry and Minister Dix release a joint statement every afternoon with the latest information on cases, hospitalizations and outbreaks, which you can find at news.gov.bc.ca. For medical guidance on protecting families and communities and for access to provincial guidance on COVID-19, visit bccdc.ca. For information about the province's pandemic supports, visit gov.bc.ca/COVID-19. And the last question this afternoon comes from Tanya Fletcher, CBC.
Thank you. Dr. Henry, if we start seeing infections in schools, will we get a daily update on how many students or staff have tested positive, when we have these daily numbers in your briefings at 3 o'clock?
We have a whole plan for how we're going to support schools going forward, and it will be absolutely, we expect, because schools will be a reflection of the community, that there will be some people positive, both in the adults in the school setting as well as potentially children. And we have a plan for clusters, so more than one case if there's transmission, and also for outbreaks. And we absolutely will be publicly reporting on outbreaks, and we'll be reporting and providing information to the school community about individual cases.
Follow-up, Tanya?
Yes, please. And if we could get an answer from Minister Dix in French on this as well, thanks. There's been so much emphasis over the summer on stopping the spread in bars and restaurants and parties and social settings, but I was kind of surprised to see how high the transmission rate is in the workplace as well. So how come there hasn't been as much of a focus on preventing spread in the workplace? And if that continues to be a concern, what is the plan of attack to combat that?
Yeah, so I think one of the reasons we wanted to present that data today is just that. There's been a lot of high-profile discussion about private parties, particularly related to the Kelowna cluster, about bars and nightclubs here in the Lower Mainland, and some of the private events that were happening were much more high-profile, and where there was public notification because we weren't able to find everybody in a rapid way. But the work in public health, we have been focusing on workplaces, and while some of the larger outbreaks have been reported publicly in workplaces, many of the smaller ones where we are able to find everybody aren't in the public eye in the same way. So there's been calls from some people to, the answer to everything is to close down the bars and restaurants. And I wanted to put it out that there's many different settings that we are having transmission, and we are working with people in those settings to make sure that the safety plans get put in place. And this is some of the work we've been doing with WorkSafe BC and with public health inspectors going to workplaces and finding why transmission is happening. And usually it's just 2 or 3 people or maybe more within a workplace, and we can put in place those measures that protect people. So here in BC, one of the most important tools that we have is every business or organization having to have their COVID safety plan, and that's a way of making them think about what does it mean for me in my setting, in my business. And those are the things that have been helping us and deal with the transmission in those settings.
I do think many of those large outbreaks in workplaces have been reported. We had obviously one in the Fraser Valley recently with 81 cases in one workplace outbreak, and would have included others in people's families as well. And certainly we've seen that elsewhere. And it's why not just COVID safety plans in place, but significant action has been taken in response to an outbreak at a nursery in Kelowna in April. We changed the way British Columbia dealt in a unique way to British Columbia with people who are coming here, temporary foreign workers coming here in agriculture. And the result has been almost no further workplace illness, COVID-19 illness on farms, because people, when they came here, were quarantined. That was a unique program to British Columbia, whereas in other jurisdictions, hundreds and hundreds and hundreds of people got sick in that sector in British Columbia. We were able to address that situation, and that's the work of public health, but it's also, I want to say, the work of BC businesses who have, across sectors, done a very committed job to reducing the spread of COVID-19. But it's a place, workplaces are places that we come together every day, and inevitably there's going to be some transmission that is effectively related to workplace, but might be an extension of household transmission as well. So I think people have done a good job. Je pense en français que les gens, surtout au travail, on travaille très fort pour éviter la transmission de COVID-19. C'est un défi quand on a quand même des millions de gens, dans les millions qui travaillent en Colombie-Britannique, de limiter absolument la transmission de COVID-19. Or, on a vu l'action de la santé publique contre la transmission en travaillant avec les entreprises, avec les syndicats, avec les gens qui travaillent un peu partout dans la province pour éviter la transmission. Je note qu'au mois de mars et avril, on a eu un problème à Kelowna parmi les gens qui travaillent dans le secteur agricole. On a pris l'action et la réponse était excellente de la part des entreprises, de la part de la secteur agricole et aussi de la part du gouvernement pour limiter cette transmission. Et donc, je pense qu'il faut quand même toujours travailler là-dessus. I want to say finally that, this weekend, with respect to private parties, let's not do that this weekend. Let's keep our numbers small. Let's remember the public health order with respect to temporary rentals, which limits to 5 in addition to the people who would be living in a temporary rental, the number of guests you can have at any given time, and to adapt that to our own circumstances in our own houses, in our own apartments. This is an opportunity, again, for us to continue to take the steps we need to take for the ones that we love and even for the ones that we don't know. Thank you very much. Merci beaucoup. À la semaine prochaine. Until next week.
Thank you. This is all the time we have today.
This show has been produced by Depictions Media. Please contact us at depictions.media for more information.